The following video is part of the Northern California Training Academy and Casey Family Program's Crisis Communication and Preparation video series. This series is designed to walk child welfare leaders through steps to take in order to be prepared before an incident occurs, including the development of a crisis communication plan, working within a political environment, and creating a narrative that promotes successful solutions that will improve the safety and well-being of children and families in care.
So let me start by showing you a short video clip. But let me just give you a little bit of background. This is about the state of Maine, and I must say I'm biased because I live in Maine and vote in Maine part-time. It was a frontline piece. It was done quite a number of years ago. It was about 10 years ago. And for whatever reason, the state of Maine let Frontline in their offices for over a year tape almost anything. Why they agreed to that is beyond me. But what they did do is give viewers an inside peek at what we live through day in and day out. The reason why I want you to see this clip is because Monica McFadden, who's on Nightline, and you may know who she is, plays the role of a reporter and is asked what it is like to cover a story like this. So I want you to hear from her directly, kind of get inside the brain of a reporter so you know what we're up against when we do crisis management. But let me just give you the setup. The setup is that a young girl died because one of the social workers in the state realized she could make more money being a foster parent and running a foster home than being a social worker in the system. So she started to take in a number of young kids in the system. It's the blonde-haired, blue-eyed little girl who was taken away not because of abuse, but because of neglect, because the mother and the grandmother were having a fight, and the grandmother blew the whistle on the daughter, okay? The foster care worker, who now has custody of the little girl, gets upset because she's kind of precocious. She locks her in the basement, puts duct tape around her mouth, and she dies. This is the first death in 10 years in the state, the only death in 10 years. So with that, I'm going to push the right button and, okay?
Partial funding for Failure to Protect is provided by the Robert Wood Johnson Foundation, making grants to improve the health and health care of all Americans. Additional funding for the seminar segment of this program is provided by the David and Lucille Packard Foundation. Frontline is made possible by contributions to your PBS station from viewers like you. Thank you.
Last week on Frontline, the story of the death of a little girl while in the custody of the state of Maine.
5-year-old Logan was killed after her foster mother allegedly tied her to a high chair and put duct tape over her nose and mouth.
The death of Logan Marr focused outrage on a normally secretive child protective system.
Who holds these people accountable? The answer is nobody.
Why was Logan removed from a mother who had never abused her and given to a foster mother who killed her?
The agency did not follow up on a complaint Logan made that Schofield had hurt her. But
Who should have kept her safe?
The Department of Human Services did not kill this child.
For many in Maine, it was an abuse of power.
No way should any court in this country of ours ever take a child from its parents based on possible, probable, or may be.
She needs to protect the baby.
What is the proper balance between saving a child and destroying a family?
He is a real threat to this child with the substance abuse, his battering.
When should parents lose the right to raise their own children?
They're supposed to try to keep families together, not pull them apart.
And who gets to decide?
I want to see my son wants to see me.
That doesn't mean it's going to happen.
Tonight, Frontline goes inside one state's child protective system.
Tonight, parts 2 and 3 of Frontline's special series on our nation's child welfare system. We begin in Maine, where in the wake of Logan Marr's death, state officials made a remarkable decision to allow Frontline's cameras into their child protective system. Tonight, you will see how a small group of caseworkers, no different than tens of thousands of others across the country, must decide the fate of children whose parents have been accused of abuse or neglect. Then, immediately following this program, we bring together a group of national experts here at Columbia University Graduate School of Journalism. We will confront them with a hypothetical case to see how they would make these difficult and often searing decisions. But first, part 2, the caseworker files. Quickly from Sandra, Janice. How's Janice feeling right now, months after the removal of her kids? Ben is bouncing around. Brittany's found possibly a home that's very, very positive. What's the mom going through at this point? What are you going through?
Well, right now, hopefully the right services are in place, and I'm saying, you know, these folks are going to hopefully give me a chance and believe that I can change. How do you know when it's that time that that person's going to change?
In your case, how long did it take?
It took me about 1.5 years, actually 17 months. Mm-hmm. While I was in treatment to, you know, get my act together and learn a new way of thinking. Counseling helped me. People saying, I'm so proud of you, you're doing great. How can I help you? I had never heard that as a child, you know, myself. How can you give as a mother what you've never received yourself?
Well, time is passing, and the permanency hearing is about 1 month away. But we turn suddenly, as much of the nation does, to another child, a 3-year-old girl named Ashley, all of a sudden. Little Ashley was removed from her mother in a situation that's quite similar to Janice's. And after 2 years of various services, various classes, some of which you've just described, she was returned to her mother. That was the permanency in her case. Today, 2 weeks after she was returned, Ashley is found dead, brutally beaten. Reports say she was burned. One report says she was stuffed in a box, her body. All by a boyfriend of Ashley's mother. An outraged neighbor tells a local TV reporter that she warned Ashley's child protection caseworker about the boyfriend a week earlier, but was ignored. So, Cynthia, you're the anchor of the Metropolis Evening News. What do you do?
Well, it probably leads our newscast that night. We want to be all over this story. We want to know who was responsible at the Department of Child Welfare. We want to know the names. We want to know caseworkers. We want to know everything we can know about the family itself. We want pictures. It's a visual medium.
What about her neighbors?
Our reporters will be instructed to cover it like white on rice. Yeah.
And it sounded like the thing that was most important to you, and correct me if I'm wrong, was getting to the child welfare person, I think I'm quoting you, who was responsible.
Well, there's plenty of responsibility to go around here.
Is that the title of your coverage? Plenty of responsibility to go around here?
Who Killed Ashley is probably the title of our piece that night. And we will be flinging blame in many directions. And probably obviously without knowing the full set of facts. But we'll be asking a lot of questions. Our lawyers will make certain that we don't actually accuse anyone of anything. We'll use a lot of alleged in our reporting to make sure that we don't get sued. But you'll certainly know at the end of the broadcast, I would guess, that that heads may roll at the department.
Who killed Ashley? Of course, we know it was the boyfriend who killed Ashley, but we also know it was a caseworker who was warned by a neighbor that the boyfriend wasn't a stellar individual and that possibly Ashley was in danger. A lot of rumor and information swirling around the coverage suggesting that the government didn't do what it was supposed to do. Caseworker was warned. Caseworker didn't take action. When a case like this breaks, what's it like to do your job? What's it like to show up at a door? What's it like to interview people, to do what you do?
It's total turmoil. Everybody is expecting to be more efficient than you probably had been already. On top of the 30 cases that you probably have been dealing with now, today you have to go see those 30 cases.
Cynthia McFadden said, heads will roll in the department. Eloise, you're running the department. Heads will roll.
Probably in this case, depending on how I handle it, what what really went on, why the decision to keep the child there or return the child may be a firing decision all the way from the bottom to the top. But typically what people do in this position is that all crap rolls downhill. Where it really gets dumped on is the caseworker, which is where it shouldn't get dumped on, because there's a lot of people in this decision-making line that help make that decision, and that they're not alone.
What do you think? What's your initial, you fellow here in the red shirt, what's your, yeah, you.
Well, it's very powerful, it's very real, it's the kind of thing that we deal with. It is interesting to hear it from the reporter's perspective.
What he said is it's very interesting to hear it from the reporter's perspective, to hear someone actually say, we're going to cover this, we're not going to know all the facts, right? We're going to use a lot of alleges, right? Other thoughts, other reactions to the,
Yeah, I think it's just interesting to hear somebody say it that clearly. We're not going to confuse the story with the facts, we're just going to put the story out. And to someone like me, that offends all kind of rational thinking in terms of, the people that are involved, the caseworker or whoever's involved.
Right. His comment is that it defies rational thinking that somebody would just move ahead like that. Remember, her comments were made almost 10 years ago, before the internet, before 24/7 news, before cable, before strategies at TV stations, which are, if it bleeds, it leads. So things have gotten faster, facts have gone further, lies go out on a regular basis as truth, and that's part of what we're going to be focused with today. But my job this morning is to do a big picture overview and to ask everybody to kind of zoom up at 40,000 feet and look at the big picture of how and why a single incident causes so much trouble within the agency and causes so much damage. You heard them say what happens during a crisis to workers in the system. We have a session on internal communications and examples of what can be done to make sure that the internal piece is done. But also, I really want to just stress the importance of communications planning, both before, during, and after. So let me just go through big picture. First of all, when there is a crisis in your community, safety is job one, especially part of the child welfare system, because your kids and your families are seen in essence as victims. For juvenile justice kids, it's a little different. For crossover youth, they're seen as perpetrators. But in child welfare, your job is safety. Now, granted, the law says well-being is a part of it, but during a crisis, the community wants to know you're keeping kids safe and you're keeping the community safe. These are the values that emerge from, in essence, any conversations, any work that's been done on child welfare over the years. These are the things that indeed the community, voters, and others want to hear about. So just as background, when you go publicly with a message and you determine what your message is, basically what the cognitive linguists who have studied how the brain processes information have determined is that there's basically 3 levels of thinking. Big picture level, which is on the values. The values of your agency include these. It's about safety, it's about prevention, it's about well-being. It's also about family, which is a core American value. It's about responsibility and opportunity. This is what the public needs to hear or wants to hear and processes. The next level are going to be those stakeholders in your community that know something about the system. They don't know the details, but they're involved in some way. They're your foster families. There's child welfare systems, juvenile justice. They may be group homes or congregate care facilities that you're working with. And then finally, down at the very bottom, level 3, are the folks that work in all the details. They're the ones that really are working on the 4E waivers. They're doing case management reform. They do team decision making. And the challenge for us is really, we often operate at level 3, and it is almost a different language than level 1. And so our challenge is really to open the conversation at the right level, at the values level, and then, in essence, prime the conversation for the audience you're talking to. You know, as I get older, I do a little bit more gardening than I've ever done before. And it's a little like, you know, most people just want to buy flowers once a year on Valentine's Day, and they know roses or they know tulips, right? But if you are indeed in the garden clubs of America, you're in like level 2, and you talk at a different level. But if indeed you are in the cultivation of flowers or the growing of flowers, you speak in Latin. You don't even speak in English. That's our challenge. We speak in Latin when we're at level 3. It's a different language, a different conversation than level 1. So this is basically your overarching planning guide for any communications. You want to start with your goals. You want to look at your mission statement. You want to integrate your values into what your main messages are. From there, you want to be clear on your audiences. You want to conduct enough research and know what people think. Sometimes that can be done by just looking at previous coverage of media. You want to develop messages, produce materials, assess resources, and then your ongoing activities. For those of you who are actually in charge of public information, this is the kind of work plan you want to develop, of which one part is your crisis and backlash planning. Again, your target audiences. Who are you trying to reach? Is it your internal agency staff during a crisis? Is it influentials? Is it elected officials? Is it schools of public policy and research like the ones we're in today? And then finally, you're going to have to repeat, repeat, repeat. If you say it once, you know that those of you that have been to social work school, and you know that when you're working with a family, first thing you've got to do with a family is show them how to do it, then you stand behind them and watch them do it, and then they do it on their own. Well, that's kind of the same principle with working with the media. You want to repeat, 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 work with the media. We're here to help guide that process, and hopefully by the end of tomorrow, you'll be able to do it yourself. Messages need to be true, emotional, supported by facts, but not just the facts. You need to compare it to what? It's not enough to say, oh, we've got 10,000 calls coming into our hotline every year. Is that good? Is it bad? What does it mean? You need to frame your message to win and build support. We're not here to talk about how do you spin a story or how do you control the media. That's long gone, but you can frame your message in a way that you can win. And you need to align them with more powerful messages, those values that we talked about, safety. You need visuals for television and websites, and again, repeat, repeat, repeat. You need to develop and train spokespeople where people are camera ready, that you don't want to put somebody on television who doesn't have the ability to speak in a language that the television audience understands. It may or may not be the head of your agency. Again, your critical elements for outreach are message development and framing, good written materials, reporter-friendly websites, editorial and op-ed strategies, radio strategies, AM and FM, are critical because a lot of people, especially in this state, do drive time in radio. So don't forget radio, and don't forget weekly and local newspapers, because a lot of times that's who they read. Your audience oftentimes, particularly in the Black and African American community, those newspapers are growing in circulation while your mainstream media are declining. Finally, here's some basic tools of the trade. Again, this is more of big picture, the things your agency needs to be doing on a regular basis. Quick response, we're going to be talking a lot about that. And finally, at the bottom it says, it's plotted out. I just have to write it. There is no substitute for a written communications plan.